first thing that I want to highlight is a few things from the update that Suzanne Judd provides to the Incident Command Center. And this one slide here, which shows both actual and estimated hospitalizations, sort of plateauing in terms of the number of hospitalizations. Plateauing, maybe an uptick here or there, depending on the time frame of the data that we're looking at. But all in all, good metrics for the area. I am concerned about the number of tests being done. That is in terms of the decreasing number of tests being done. We can't find disease if we aren't testing for it. And I think that's particularly why I'm concerned. If there is an uptick in hospitalizations, then I'm worried that we're not doing enough testing and that we may see an increase in hospitalizations before we see an increase in cases, which is the opposite of what we have been seeing. I won't spend time on this slide with a lot of links, nor this slide, which simply indicates where we have been in terms of the valley, which for us, we did hit one valley in late October. Then it bumped up again in Alabama, but now it's continuing to decline, as I think these numbers by district would indicate. So overall, again, a decline, slow but steady decline in cases in the state. Here are the age groups. Again, that big spike is the youngest age group, which yes, does have a larger group of individuals, a larger number of ages in that age group compared to the others. So it's a little bit like apples and oranges, but nonetheless, I think you can glean something of value from this slide. Here's the New York Times COVID tracker, and you can see that here was that little valley that Suzanne was referring to before we spiked, and now continuing to decline. As we saw last year, we saw an increase after Thanksgiving. We'll certainly be on the lookout for that. Continuing to inch up and maybe even less than inching up on our vaccine coverage, but inching up nonetheless. So here's the Alabama map. And these are the CDC's metrics. And again, the CDC uses the cases per 100,000 per week, whereas the New York Times tracker, that's cases per 100,000 per day that they're looking at. So you can see in Washington and Perry and Barber counties, there's low transmission, which means 0 to 9.99 per 100,000 per week. In Jefferson, it's still on the moderate scale. We do have counties just to the north of us that show a higher level of transmission.
We're currently processing about 225 or so cases per day. That's what we're assigned. And the number of lab reports that we need to process has been moving up steadily. It dipped below 100 per day last week. And then this week it's up now. Today it was 142 or so. So there's a little uptick in that. A few more cases positive cases seem to need to be called. It's not a dramatic change, but there are a few more. One of the interesting things that we have started monitoring a little more carefully is how many of the calls we try to make, interviews we try to conduct, turn out to be productive. Initially, once we became better at this, it was on the order of 70%. You make a call, get someone on the phone, or get them to call you back, and you get about a 70% complete the interview rate. Now it's under 50. And this will probably come as a shock to many of you, but the lower numbers appear to be associated with interviewers who are not of this country, let me just say, international students, for example. The second phenomenon associated with that is we seem to be interviewing or trying to interview more and more people that are unvaccinated. In fact, the majority of the cases, something in the order of 80% plus of the cases we're now positive results that we're now calling are unvaccinated, and they do not like to be talked to. They generally do not wish to be interviewed. We have, our contract has been extended through April 30th. Although we do not have the signature page back from ADPH as of this morning, the wheels of getting signatures turn slowly at both UAB and ADPH, but I've been assured it's on the way.
We're moving along. It's been a huge process. It's been a political process in the state, as you all can imagine. And, you know, back in the summer when we were initially planning this with schools, there was not much interest in testing in schools. But as the fall semester has progressed, and especially since talk of the Omicron variant, there's been more and more interest from schools. And I'll let y'all know the numbers in just a minute. So, you know, we started in the summer by releasing a request for information for testing vendors. We had 10 vendors respond to that. We went through a selection process, NIH kind of study section style, where we had primary and secondary reviewers for each vendor, and narrowed it down to a number of vendors that could provide turnkey models. Then, of course, we followed up with them to ask additional questions and to look at pricing. But as of now, we have entered into fee-for-service agreements with 2 vendors that are currently testing in our schools. Currently, we are doing individual PCR testing at every location except one. And I'll tell you what's going on there. But, you know, eventually, under the advisement of our scientific advisory board, we may move to a pooled testing model. But right now, we're holding at doing individual PCR testing. The one school that we're not is the Alabama Institute for Deaf and Blind. They wanted antigen testing just because kids come in on Sunday and then they're in the dorm. So they want something immediate, you know, as kids are getting off the bus, so that they can say, okay, they can go in the dorm or not. So we are doing antigen testing there, but we're following up with individual PCR testing. So as of last week, and this last 2 weeks have been kind of hard to tell because of holidays, and different schools have different holiday schedules. But as of now, we have 168 schools that have entered into a testing agreement with us. That's 13 independent schools and 15 public school districts, with a total of 153 locations just for the public schools, and then another 15 locations for independent schools. We are not quite testing in all of those schools now. We're only testing in about 110 schools now, because some schools just contacted us and we're just getting the agreements in place, and they actually want to wait till the students are coming back after the Christmas holidays to begin their testing. Right now, though, as of this week, we have 108 testing events currently happening across these different locations. In addition to the schools that we're already working with, we have contacted over 580 additional schools in the state, schools and school districts, and are sending out additional information packets to the superintendents who have not yet signed on to the program. Just, we've contacted them in multiple ways, even through the Alabama State Department of Education and through the Independent School Consortium. But we just don't want any superintendent or school leadership to be able to say that they didn't know about this program or didn't know that. So we're sending out some additional information packets to all of those folks in the next week. We are currently planning with 102 more school sites. So we're working on the testing agreements with those schools. And we hope to have all of those in place by the time they come back from Christmas holidays. And again, I think it's because of the Omicron variant that we're getting a lot of interest now from schools who weren't interested even 2 months ago. Right now, consenting is still a challenge. Consent rates are, somewhere on average of 10% in a school, and that's across faculty and staff. It's really kind of hard to get an exact number because it's a moving target, and every week you might have a few more kids consenting, but we are working with the schools to kind of up that consent rate within the schools to make sure that additional messaging is being sent out to parents, to staff and faculty in those schools to make sure that they understand that they can be a part of this program and that they're welcome. So as of now, we have over 3,644. Well, it's probably around 3,700 students now who have consented for testing. And we have almost 900 staff members who have consented for testing. Now, the week of 11/15, there was a lot of schools that were closing early and, different schedules. And so we weren't able to test in all the schools that week. But that week we had over 2,500 students. It was 2,506 students who tested. 8 tested positive, so like 0.3%. So I guess that's a good sign. And we had no staff test positive during that week. I think this week is really going to be more the tell, though, because everybody's back from holidays and from their short schedules. So that testing. So it'll be interesting to see what the numbers are this week.